London researchers have launched a new clinical trial hoping to improve outcomes for patients living with kidney failure. As Lauren Stallone reports, dialysis treatment can keep people alive, but it comes with challenges.
Frank Ansell used to spend his days traveling. Now his life tells a different story.
For about 10, 12, 14 hours after dialysis, I am worthless.
After nearly 3 years on dialysis, Frank says he knows the harsh realities firsthand.
I see people sitting across from me having dialysis that get up and go and drive a city bus afterwards. I leave dialysis in a wheelchair.
Now his next destination is helping to transform dialysis for future patients.
I'm a patient advisor, and this opportunity was presented to me 2 years back, and I thought it behooves me to give back to my community.
Frank is working with researchers in London who are testing a new dialysis filter they believe could help patients live longer, healthier lives.
They want to make sure that what they're proposing from their perspective would be fine from a patient's perspective.
Dialysis is an essential life-sustaining treatment for millions of people living with kidney failure. It uses a special filter to do the work of the kidney by removing waste, salt, and fluid from the blood.
Blood actually flows through these tiny fibers, so it's inside of the fibers, and around the fibers flows a fluid, something called dialysate, which has the correct concentrations, as far as we know it, of salt and potassium and calcium and all of these elements that we need to sustain life.
Experts warn dialysis can lead to quality of life concerns, with most patients requiring treatment at least 3 days a week.
We're doing the study to determine does removal of these toxins with these new filters actually help people live longer, stay out of the hospital, not get hospitalized, and feel better.
Dr. Pavel Rashanov, a scientist at London Health Sciences Centre Research Institute, says 50% of dialysis patients are expected to pass away within 5 years of starting treatment.
We think a big part of that is that the dialysis filters are not as good as a natural kidney. There are things that they do not remove as well.
Unlike standard filters, the newer generation of filters remove larger toxins from the blood.
We call them larger because they're just the size that doesn't fit through the normal pores that our typical filters use.
The 5-year trial, called Dialex, will include up to 4,800 patients across more than 100 dialysis units in Canada. Participants will randomly receive either the standard filter or the newer type of filter. The study will track symptoms to determine if the new filter improves patient outcomes, something Frank says he's hopeful for. And while his days of traveling are put on hold for now, perhaps this journey is just as special.
It's like a country club of friends. It's like you're in the pub, except nobody's drinking, and the patients are chit-chatting. It's actually, for how bad the experience is, it's a beautiful experience.
Lauren Stallone, CTV News.